Senior warning! Dr. Kernisan, geriatrician, advises us about vitamin B12 deficiency as we age. Hello, Humpty from We Are Positive Agers with critical information about your health. Dr. Kernisan, geriatrician, is my go-to advisor on aging health. I'll tell you more about her at the end of this video, so stay with me. This long format video is the first in a series I call This Old Body, to discuss the many changes we go through as we age, hopefully long and well. I've found that many of my followers and subscribers prefer short videos, so this will be revised in a short form if you're too busy to watch it in full here right now. Dr. Kernisan states that many older adults can develop a B12 deficiency, even when they're getting their recommended daily amount. It may be in your daily vitamin, but still not sufficient for you as you age. She maintains that B12 deficiency is very common, with up to 20% of agers not getting enough, and doctors may not catch it. Please allow me to present her advice frequently, paraphrased, without the tedious process of continuing to repeat her name. This is not my area of expertise, and I rely on her professional opinion and judgment, as do thousands of her followers. We need vitamin B12, also called cobalamin, to help build red blood cells that carry oxygen to our tissues and organs throughout our body. It's especially important for proper functioning of nerve cells. Low B12 levels can cause anemia, neuropathy, and cognitive impairments, among other problems. Where do we get B12 in our diet? It comes from meat and dairy products or supplements. When it enters the body, it's absorbed in the small intestine and then stored in the liver. Since only a small amount is needed each day, your storage could last for years, but when the bank goes broke, the symptoms of deficiency can pop up. So why are older adults often deficient in vitamin B12? As we get older, we don't absorb B12 as effectively as when younger. We often have problems with the level of acid and stomach enzymes required to process this vitamin. Other risk factors contributing to lower levels of B12 include the use of medications that reduce stomach acid. For example, those taking metformin for diabetes may be affected. Excessive alcohol consumption could also be a contributing factor. Alcohol irritates the stomach, and inadequate amounts of B12 might stem from the drinker's poor diet as well. Surgeries to the stomach or illnesses such as Crohn's disease add to the list. Why do doctors misidentify effects of low vitamin B12? Mainly because the common symptoms of low B12, such as fatigue, anemia, neuropathy, memory, or even walking problems, can be caused by something else. Unfortunately, a condition of low vitamin B12 deficiency will almost always get worse if untreated. So when seeing your doctor, get it checked out. The good news is that B12 deficiency is treatable. The key is detection and then treatment. Don't ignore the possibility that this is underlying the health symptoms described above. Another risk factor can stem from having a very good diet of vegetables while avoiding lean meat or dairy products. Vegans and vegetarians, or those with a predominantly plant-based diet, should investigate supplementation. This is where it becomes a concern for me, and I intend to pursue the issue. In her video and written narrative presentation on this topic, Dr. Kernisan goes into far more detail than I'll provide here. I'll leave some links below to direct you to her Better Health While Aging website that contains her videos and the article on which my video is based. You can also find her many videos on YouTube. Thank you so much for watching, and I hope you find Dr. Kernisan's health advice for agers of value. If you appreciate this video, please give me a thumbs up, leave some comments, and punch that subscribe button. If you have a friend or loved one in need, please forward or paste this video in an email and send it to them. Have a positive Ager Day, and may you find greater peace and potential help as it unfolds.